To be a leader in oncology, you don't settle till you have the right answer.
There is a tremendous amount of excitement within AbbVie for the future prospects in oncology.
We have a number of phased clinical program medication candidates that are aimed at both the hematologic malignancy space as well as the solid tumor space.
If this is successful, it could make a remarkable impact in cancer patients' lives.
Welcome to ASH News TV. I'm Rachel Kopchak, and Ed Hyland joins us now with groundbreaking myeloma news that's hot off the press.
Thanks, Rachel. Research details were released here in the press briefing area today that may prove to be the holy grail for treating conditions like myeloma. Results were presented at a news conference detailing novel therapies that showed remarkable results. While the studies were limited to just a few patients, in one, experimental lentiviral gene therapy was used in the first in-human trial using a patient's own genetically modified immune cells to eradicate signs of multiple myeloma.
Where you're making a small amount of your own globin, now the gene therapy can top you up just enough to take you over into a normal range, and those patients become transfusion independent. So this is very, very exciting.
The implications are that some of these patients will have extraordinarily favorable outcomes despite their previously thought to be adverse risk. And based on these findings, it will then be possible perhaps not to further intensify treatment.
Also released at ASH, new genomic insights that may lead to more personalized approaches for pediatric patients. Studies linked through a huge database of patients are isolating key information that is having an impact on survival rates. Among the findings discussed were genetic mutations in children with acute lymphocytic leukemia that indicate a higher risk of chemotherapy-associated bone damage. Another study examined the potential of using real-time genetic analysis to personalize treatment for children with BALL. And finally, researchers have discovered genetic variants that may be associated with the development of autoimmune bleeding disorders.
We're understanding more and more that clearly genetics, inherited genetics of both the patient themselves, their inherited genetics, and the disease-specific biology play a tremendous role in both response to treatment and toxicities of treatment that we'll learn from and will be able to modulate to further improve outcomes.
ASH is on the cutting edge of newly released hematologic drugs. This session focused on 3 specific drugs made available by the FDA in just the past few months. While the drugs have passed rigorous clinical testing, the real test is how best to help patients.
We have docs who are struggling with how to actually use them in their clinical practices. This session is about the practical clinical use of the drugs, both highlighting their efficacy and how to manage the side effects.
A discussion on the political landscape in relation to the field of hematology took place here at the Grassroots Luncheon. Journalist Ron Fournier with the National Journal addressed our current state of affairs, which included how to deal with the polarization of the electorate and the way the presidential candidates are pitting one group against the other. ASH's Committee on Government Affairs plays a big role in advocacy, which includes going to Capitol Hill, raising appropriations for the NIH, and issues related to patients such as the cost of drugs.
We're working on a bill in Congress to have oral parity. If there's a chemotherapy drug that costs a certain amount as an IV form and there is an oral form, there should be equivalence so the patients don't have to pay a lot of money out of pocket if they're taking an oral form of the pill.
After a short break, we'll be back with much more ASH News TV.
Welcome back to ASH News TV. Attendees of the annual meeting have access to attend sessions where the conversations are informational and take place in an informal setting. Continuing the conversation with the speaker sessions are for a limited audience of 40 participants. This gives trainees and junior investigators increased accessibility to scientific program session speakers on a range of topics. Genomics, the next frontier, novel approaches to study cancer and development, stem cell succession, replicative stress and somatic reversion, harnessing T cells in therapy of hematologic malignancy. As the premier journal Blood celebrates its 70th anniversary, ASH is preparing to launch another journal, online only, in 2016.
ASH is starting a new journal, tentatively called Blood Reports, and that journal will allow us to expand our coverage of all of the specialties of hematology, including basic research, clinical research, translational research, and even policy-type issues. So in that context, ASH is looking for a founding editor for the new journal. And it's quite a unique opportunity. A journal will only ever once have a founding editor, so this person will have a major role in creatively setting the tone and setting the goals for the new journal.
The new journal will offer rapid publication with peer review. Papers will be accepted either from editors of Blood who have reviewed papers but don't have room to publish, or papers can be submitted through traditional means. If you're interested in becoming the founding editor, visit hematology.org for more details.
ASH 2015 gives members the opportunity to learn from the full breadth of hematology, and nowhere is that more evident than in the plenary session. Not only can you learn what's on the horizon, but there's also the potential to change clinical practice.
So we have everything from red cell issues to coagulation to malignant hematology, and all the way from the very, very basic abstracts to very large-scale clinical trials. So I think you'll have something for everybody.
Networking is a vital part of the ASH experience. Coming up on Monday, a networking reception for female faculty will help to connect women in all stages of their careers. Head to the Hyatt Regency Ballroom's OPQ Monday from 7:30 to 9 p.m.
I think it's going to be very exciting to have the opportunity to work with young people, and the young people to work with some of us who've been around for a while, and to gain our insights, to see what their interests are, and to, again, validate them, emphasize the importance of what they're doing, and really to introduce them to people that might be helpful in their careers, and if they're interested, to give tips on how to balance life and career. Not that we have all the answers, but just to talk about those things sometimes validates your own feelings about what you can do.
When I was a student, mentorship really wasn't talked about as it is today. And it is a competitive society, I mean, in terms of research, that to become funded, to stay funded, to be able to have the resources to do great work, that you need to be able to network, you need to develop sustainable collaborations, and a mentor can help introduce you and guide you in the right direction.
Looking beyond PI3K delta in non-Hodgkin's lymphoma, Bayer is committed to investigating the PI3K pathway and the role of specific isoforms in NHL.